there's not just simply pain nerves, although we're going to talk about that here in just a second. There are many, many different types of nerves that are embedded in different aspects of us. And in certain body anatomy, in certain body areas, those nerves are a lot more dense. There's a lot more of those nerves there. For instance, in our tongue, very dense amount of those types of feeling nerves or taste nerves as well, as let's say. In our face, very, very sensitive and dense nerves. In our spine, extremely, extremely dense amount of nerves in our spine, especially up in the neck. In our fingers, to be able to manipulate and move them around and feel very, very small objects and what those objects are. Very, very large amount of nerves in that aspect of our body. Let's say compared to our toes. Think about it. Can you determine what something is, what a structure is, by feeling it better with your fingers or with your toes? Now, this next image is going to show you just how many different types of nerves there are and how they differentiate between each other. Now, underneath the receptor type column, so to speak, you have these cutaneous or subcutaneous mechanoreceptors. There's a lot of big long words there, but what I really want you to see is these are the touch nerves. And you can see there are different nerve endings that allow us to feel different things. Look under touch there on the right-hand side. Stroking and fluttering is one kind of nerve. Pressure and texture is another. Vibration is another type of nerve. Stretching of your skin is another type of nerve. There's some more stroking and fluttering of a different type, but it has to do with hair. So there's a difference between nerves that are associated with our hair than there is with our skin, for instance. Well, let's go to the next one. There's heat and cold nerves, the thermal receptors. And look at this, there's to a certain degree 4 different kinds here. One for skin cooling, one for skin warming. There's one for hot temperatures, one for cold temperatures. So it depends on the temperature of what you're feeling, hot or cold, warm or cool, as to what certain nerves are stimulated. Now we get into the pain aspect of things. Now pain is extremely complicated, but in a very basic sense of the word, you have pain nerves in the periphery are called nociceptors. And there's a mechanical one, a thermal, hot or cold mechanical one, as well as one that does both. But look over on the right-hand side. There's a certain nerve there that's sharp and for pricking pain, one that's for more burning pain, freezing pain, or slow pain. Now this last one is for muscle and skeletal nerves. Now these nerves, for all intents and purposes, do not transmit pain. But look on the right-hand side. You have one that senses the length of your muscle and the speed of which it moves. The stretch of a muscle is another one. If the muscle shortens or contracts is another nerve. The angle of how a joint is positioned. If your elbow's bent or straight, there's another nerve. Then there's one for excessive or a lot of stretch or a lot of force. Now you can see there's a lot of different types of nerve endings. Let's say this nerve ending in an aspect of our skin is for cool temperatures. This one's for hot temperatures. This one's for warm temperatures. This one's for very cold temperatures. This one's for a joint angle, how our elbow is bent. This one is if the muscle is shortening. This one if the muscle's moving fast. There's a lot of different types of nerves that tell our brain what we're experiencing. So depending on what we're feeling, a lot of times you'll go to the doctor or the clinician and they'll ask you, well, describe your pain for me, or describe what you're feeling. To the properly trained clinician, how you describe it helps us zero in on what aspects of your nervous system may be not functioning appropriately. Now, I'd like to elaborate a little bit more on the density of these nerves in different parts of our body. How many of those nerves are there? If there's a lot of them, that allows us to feel and sense a lot of things and be very precise with what we're feeling and sensing, or if there's just a few, relatively speaking, that doesn't allow us to sense as much. Now, what I want to do is talk about these proprioceptors or mechanoreceptors. And here are a couple of studies that show you how dense these movement and receptive nerves are within our spine. And I want you to understand this this aspect of things because it has everything to do with a certain component. Well, let me back up. Not everything, but has a lot to do with a certain component of how much pain we feel. Now, these two studies here talk about the density of these nerves in the muscles and joints of our spine. This first one is back from 1994. Proprioceptors, we'll just call those movement receptive nerves, provide information at a conscious level about the position and the movement of reflexes that change how our muscles act and controls our posture to prevent certain injury or deformation to joints and other tissues associated with joints and our muscle system. So it has a lot to do with pain. The most common causes of pain, folks, is when that aspect of our muscle and joint system of our body is irritating certain nerves in one way, shape, or form. Now, the reality is when these movement receptive nerves are not sending as many nerve signals into the brain, we're going to feel pain more. So nerves that have, to a certain degree, nothing directly related to how we feel pain or irritation to those pain nerves we talked about before, but these movement nerves, if they're not sending as many signals into the body or into the brain for whatever reason, we're going to feel pain more, no matter what that pain is to a great degree. Now, the second study is from 1992 and Abrams in 1992. And I want to talk about, this study talks about the density of those nerves, those movement receptive nerves or joint position nerves in our neck. A characteristic of neck muscles is an abundance of what's called muscle spindles. Now, the muscle spindles are those movement nerves, so to speak. The density in a large neck muscle is about 46 to 106 per gram of muscle. It's among the highest anywhere, but let's skip down there where it says muscles that are small and close to the neck bones may have up to 500 spindles per gram, which is a density of over 100 times more than the larger muscles of our neck. So the muscles that are deep down in our spine, and especially in our neck, have a lot more nerves, movement receptive nerves, than the larger muscles of our neck do. Now you can extrapolate that off to our biceps muscle or our hamstring muscle. A lot more nerves are embedded in the deep, deep layers of our spine than there are in the much larger muscles. And so when those muscles aren't moving as well or are stiffer, it's going to decrease the amount of nerve signals into our brain, which is going to allow us to feel any kind of pain more readily. If you're walking through you get up late at night, you slam your big toe into the bedpost, if the muscles of your spine potentially are not as flexible and strong like they're supposed to be, you're going to feel that big toe that you just slammed into the bedpost a lot more than you would if those spinal muscles, deep spinal muscles, were more flexible and reacting appropriately. This image that's on the screen now generally shows how that nerve signal of, say, a movement receptive nerve that's stimulated, how that nerve signal travels through the central nervous system. That's a very simple map on how that sensation of movement gets transmitted up to our brain. So there's many different levels that that signal traverses or passes through. Pain is another one of those nerves. And pain is a very, very complex thing. How we perceive or feel pain has a lot to do with our emotional state, the chemistry of our body, and how fit we are to a certain degree. So in future shows, we're going to break that pain aspect of things down very specifically to help you really understand how we can affect pain in a positive way. But there are a couple of different things that we have to understand with pain. Pain in the periphery, generally speaking, can be caused by some kind of compressive or physical forces or destruction of certain types of tissue that create that pain nerve stimulus, or it can also be due to certain types of chemicals, natural and unnatural, bathing some of those pain nerves. Now this next image shows you down here in the bottom middle aspect that's flashing that you have a certain aspect of a pain nerve being stimulated and how it travels up the spinal cord and goes into certain aspects of our brain. That is a very, very basic map on how pain travels from the periphery up through the spinal cord into our brain. And as I mentioned, there's many different things that affect pain. One of them, as we talked about earlier, is having more flexibility and fitness within our muscle and joint system of our body, because we always have pain signals traveling to our brain. They just may not be strong enough for our brain to realize that sensation. Now this show was about helping you understand that there are many different kinds of nerves, very generally how they work and where they end up in our brain. We're going to break down more of the nervous system here in the upcoming shows here, and also give you some information on how we can affect those nerves in a very positive way for lasting health and less symptoms as we live. Thanks for joining me this week on Naturally Healthy. I'm Dr. Craig Steingraber here at the Summit Healthplex, and have a great day.